This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Friday, May 1st. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at our VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. The United Nations Secretary General says the lack of global strategy to fight COVID-19 has allowed the deadly disease to spread. Speaking in an interview with the BBC, Antonio Guterres says it's tragic that the world leaders have not been able to unite to battle coronavirus in a coordinated manner. Guterres is urging the world key countries to develop a common plan and present that to the international community. The UN estimates that 8% of the world's population, about 500 million people, could be forced into poverty by year's end because of the devastation brought by COVID-19. The global tally of coronavirus cases continues to rise. There are more than 3.2 million confirmed cases worldwide, with more than 233,000 deaths, according to early Friday numbers from the Johns Hopkins Coronavirus Resource Center. The United States leads the world in the number of reported cases and deaths. Hopkins says the U.S. has over 1 million COVID-19 cases, one-third of the world's total. More than 63,000 people have died in America from the virus. Turning to Africa, Senegal, with a population of nearly 16 million, is reporting 933 COVID-19 cases with 9 deaths, according to Reuters. Despite declaring a state of emergency, closing schools and issuing restrictions on gatherings and travel, coronavirus cases are continuing to rise. Zambia's Ministry of Finance says it is receiving $145 million from the U.S. and Britain to help fight COVID-19. The Southern African country has confirmed 97 infections and 3 deaths from the virus. Namibian President Hage Geingob says the country will begin to ease national virus restrictions on Tuesday to allow the return of economic activity under a strict observance. And the UN World Food Programme has dispatched its first plane load of medical supplies bound for Burkina Faso as it helps developing nations to battle the coronavirus pandemic. Across Africa, people are finding local solutions to the global challenge of the coronavirus pandemic. From technological innovation to community collaboration, ordinary citizens are issuing the resources at hand to address the unprecedented hurdles they are facing. Africa 54's Zoe Ludaki has the details.
In Senegal, 3D printers are being used to compensate for a lack of medical equipment in health centers. A local technology group is mobilizing 3D printers in small workshops throughout the country to make plastic visors for healthcare workers. In Dakar, workshops print and assemble dozens of masks every day before delivering them free of charge to hospitals, pharmacies, and clinics.
We saw that there were a lot of initiatives in other countries to equip doctors. In Senegal, we have a problem regarding equipment and resources. We had a 3D printer, so we started manufacturing because we could help.
Similarly, in Liberia's capital, Monrovia, residents are taking matters into their own hands by setting up neighborhood checkpoints to screen the temperature of those who enter and wash their hands, a strategy already used during the Ebola outbreak a few years ago.
Liberians are still doubting that the sickness is not in the country. That's all their belief. So when they saw the guys putting those gates and things down, telling people to wash their hands, having the instrument testing and taking the temperatures and things, some try to get the art that indeed it is true.
In South Africa, President Cyril Ramaphosa has announced a landmark $26 billion relief package to boost the economy and support the country's most vulnerable people. This comes after violent clashes with police in some areas over food parcels amid one of the world's strictest COVID-19 lockdowns.
Another significant area that requires massive additional expenditure is the relief of hunger and social distress in our communities across the country.
However, some local measures elsewhere have raised eyebrows. Madagascar President Andry Rajoelina is promoting a drink that he says can prevent COVID-19 and cure infected patients. Based on local medicinal plants, the concoction is prepared with Artemisia, a plant with proven success to treat malaria. It must be stressed, however, no published scientific study has shown that the COVID organic herbal tea is effective in treating the coronavirus. Even so, the military is now distributing the drink to residents and students who are returning to school after a month of confinement. Alternative medicine is nothing new in the Democratic Republic of Congo, where Kinshasa traditional healers say these Congo bololo leaves alleviate coughs and fevers when boiled. Meanwhile, health workers and doctors in Malawi are refusing to work until the government provides them with personal protective equipment and better pay in the wake of the coronavirus pandemic. At the Kamuzu Central Hospital in Lilongwe, many patients were forced to return home as there was nobody to attend to them. In Uganda, Kampala authorities are providing shelter to street children during the nationwide lockdown. 180 of the most vulnerable are being housed in a primary school.
When the lockdown happened, we had children that live and work on the street, and when the directive to stay at home was made, they did not have a home to go to because their home is on the street.
Local music has got a continental twist as well. The United Nations Children's Fund has released a new version of the Miriam Makeba hit Pata Pata, performed by Benin's Angelique Kidjo. The tune remains the same in what was once called the world's most defiantly joyful song.
This is what we gotta do, Papa. We need to keep our hands clean.
The song has particular resonance for Kidjo, whose friend Afro-jazz icon Manu Dibango died earlier this month from the coronavirus. Zoe Liudaki, VOA News.
U.S. President Donald Trump let federal social distancing guidelines expire Thursday and expressed optimism that states can relax restrictions and reopen the economy at their own pace. But some public health experts are concerned about potential consequences.
Restaurants in the U.S. state of Georgia have joined other businesses that are now allowed to serve customers after a month of lockdown.
We're doing the best we can to follow the guidelines set forth by the governor, by the president.
U.S. President Donald Trump did not extend federal social distancing guidelines that expired Thursday. He expressed optimism states can relax their own restrictions and that the ailing economy will soon rebound.
I think you're going to see economic numbers that are going to be fantastic. I believe it very strongly.
That despite Labor Department figures showing about 30 million Americans filed jobless claims since mid-March. Federal Reserve Chairman Jerome Powell has a more pessimistic outlook than the president.
The ongoing public health crisis will weigh heavily on economic activity, employment, and inflation in the near term and poses considerable risks to the economic outlook over the medium term.
The White House in mid-April released guidelines for states to reopen their economies. Called gating requirements, it's based on a decline in documented coronavirus cases and hospital preparedness, among other factors.
You have about 30 states that are now either in the process of reopening or thinking about it. Probably only a handful actually even meet the initial White House gating requirements there.
President Trump said his administration is working with the private sector to accelerate vaccine development. The nation's top health expert says a drug called remdesivir is showing promise.
The mortality rate trended towards being better in the sense of less deaths in the remdesivir group. 8% versus 11% in the placebo group.
But for right now, before any area or state rushes to reopen, the think tank Bipartisan Policy Center wants communities to keep evaluating their own progress to protect the public's health.
Declining cases or the percentage of positive tests in a sustained manner for at least a couple of weeks. The second is increased testing capacity to not only just test individuals who have symptoms, but also vulnerable populations. A third is having a healthcare system that is under capacity. And fourth is, again, having a public health system that can do the important detective work and contact tracing.
Even in states technically still under lockdown, many flout policies to stay indoors, including beachgoers in Southern California. Patsy Widakuswara, VOA News.
Ahead of Sunday's World Press Freedom Day, activists are warning that the coronavirus emergency has seen governments around the world crack down on journalists' ability to do their jobs, even in established democracies, at a time when transparency is more vital than ever. Henry Ridgwell reports.
Media rights group Reporters Without Borders puts North Korea at the bottom of its index on press freedom for the fourth year running. The North's state-run media have reported 0 cases of the coronavirus in the country. Scientists dispute that claim. The pandemic has seen press freedoms curtailed in many countries, says Reporters Without Borders' Rebecca Vincent.
Some of the states that were already cracking down on press freedom have accelerated those crackdowns now, and others, and actually some of the same states, are targeting journalists who are trying to report the truth about what's happening in their countries and retaliating against those who do. Sometimes we can talk about it in an almost theoretical way, sort of what press freedom means to all of us, but now we can see that actually the absence of press freedom or severe restrictions on it can have, at times, deadly consequences.
Hungary's new laws threaten 5-year sentences for anyone judged to be hindering measures to fight the virus. Journalists say they fear being jailed just for doing their job. In other established democracies, including the United States and Britain, activists say government transparency is under threat amid the pandemic. The United Nations Secretary-General recently voiced his concern.
More than ever, governments must be transparent, responsive and accountable. Civic space and press freedom are critical.
Some countries have made improvements, says Vincent.
So this year we can look at the Maldives, Malaysia and Sudan as examples of countries that have implemented reforms and risen up very quickly, substantially in the index. These are all countries where we've seen changes of government.
Safety remains a big concern. Reporters Without Borders says 49 journalists were killed in 2019.
Although fewer journalists in 2019 were killed in conflict zones, a greater number than ever were killed in countries that are meant to be at peace. And so these are very often journalists who are being deliberately targeted.
European countries make up the top 5 of the Press Freedom Index, but there have also been high-profile murders of journalists, including that of Lyra McKee in Northern Ireland last year, Jan Kuciak and his fiancée Martina Kuznirova in Slovakia in 2018, and Daphne Caruana Galizia in Malta in 2017. Her family is still seeking justice. Henry Ridgwell for VOA News, London.
U.S. stocks index futures dropped again Friday, with the Dow Jones Industrial Average down about 2% and the S&P 500 and Nasdaq 100 down more than 2%, indicating further decline in trading from a day earlier. In Europe, London's FTSE index, the DAX in Frankfurt and the CAC 40 in Paris declined more than 2% in early trading. Japan's Nikkei index lost 2.8% and the S&P 200 index 3.6%, while most other Asian markets were closed for the May 1st holiday. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, going all jazzy, the music of Senegalese jazz artist Alune. We'll be right back after this break. Welcome back to Africa 54. The global demand for medical ventilators is rising as COVID-19 spreads worldwide. A team of frontline doctors and engineers from Imperial College London has developed what they say is a low-cost, high-performance emergency ventilator that could be quickly rolled out across developing countries with poor health systems. Here again is Henry Ridgwell with more.
Let's take a look inside JamVent.
It looks simple and deliberately so. The designers went back to basics and came up with JamVent, a ventilator that can be built cheaply anywhere in the world, says project lead Dr. Joseph Sherwood.
So by knowing the way that a gas behaves under pressure and how the flow of a gas occurs through a valve, you can actually choose the components of the system such that you can control the pressures and flows exactly as you need to, without the need for these complex components.
Those complex parts can cost tens of thousands of dollars. Instead, JamVent uses readily available off-the-shelf components, explains co-designer Dr. Jakob Matizig-Lee, who treats COVID-19 patients.
We're not competing with existing ventilator designs for parts, and also because it's so simple, actually it's very scalable to build and very easy for someone to source these kind of parts kind of anywhere in the world, really.
That includes developing countries with poor health systems. Some African countries have only a handful of ventilators to treat millions of people. The designers plan to seek approval for clinical use next month, including in Britain and the United States. Unlike other recent designs, Sherwood says the JamVent is designed to meet the full demands of intensive care.
So this is not a bridge ventilator, this is a ventilator that performs all of the functions that you need in the ICU to cope with COVID-19 patients and their demanding requirements. The design is actually freely available, and we will work with different manufacturers to go through their own regulatory procedures.
Its potential goes beyond the COVID-19 pandemic, says Dr. Matizig-Lee.
There's no reason that this can't be used to kind of supplement ICU capability around the world going forward for any kind of respiratory condition.
The JamVent design is freely available on the website, and governments and healthcare firms are encouraged to get in touch. Henry Ridgwell for VOA News, London.
New York City's health department is one of the best in the world, yet it was overwhelmed by the number of coronavirus cases. Dr. Tom Frieden, a former New York health commissioner, later the head of the CDC and now the president of a global program based in New York, spoke to VOA's Carol Pearson.
I was born in New York City. I was a medical student here at the height of the AIDS epidemic. I did my training in public health and in internal medicine here, also at the height of the AIDS epidemic in the 1980s. I started my professional career as an epidemic intelligence service officer here in New York City.
Dr. Tom Frieden's New York is a far cry from what the city looks like today in the midst of a coronavirus pandemic.
I'm a New Yorker, and I'm just heartbroken to know the number of healthcare workers infected, the number who've died, the number of people whose lives we've lost. Every day in the paper, we see just a tiny fraction of the number of obituaries.
Currently, there's only testing to see who has the virus. There's no treatment for it and no vaccine to protect against it. To save lives, Frieden says societies need to follow the lead of public health experts.
Public health can scale up its traditional tools of testing, isolation, contact tracing, and quarantine. If you get those four things right, you can box the virus in. And by boxing the virus in, you can reduce the number of cases, prevent clusters from bursting out into outbreaks and epidemics, and increase the space for all of us to return to society.
Yet the virus will still be out there, and it will still be dangerous.
No one should underestimate how deadly this virus can be.
Even after the worst of this pandemic is over, people will still have to take precautions, because if they aren't careful, Frieden warns, the virus will come roaring back. Carol Pearson, VOA News, Washington.
In Nigeria, Africa's largest economy, businesses across the country have been shut down and people are asked to work remotely from their homes. The shutdown has been especially hard on the wedding industry because of its dependence on crowds and physical gatherings. Ifyoke Tang reports from Jos, Nigeria.
Patience Ozohu has enjoyed a lucrative business in Nigeria's wedding industry as a makeup artist and beauty consultant for the last 20 years. But she says avoiding physical contact with her clients is a difficult task in her line of work.
The different textures of the products we use and the texture of our client's skin, we need to be able to gauge that so that we are not, goofing while we're doing our job. And a lot of thought goes into what we do. And if we are not able to touch and feel, okay, it poses a serious problem.
An average Nigerian wedding cost about $13,000, with high-profile weddings costing over $250,000. The industry generates tens of millions of dollars each year. But due to safety precautions over COVID-19, many of its business are facing challenges.
I have weddings that have been booked prior to the COVID-19 pandemic, and now we have to reshuffle appointments and bookings, and nothing is coming in. Clients are panicking. Some want to cancel, some want a reduction.
Most weddings in Nigeria are public and have large crowds in attendance. But with government banning public gatherings of more than 50 people, many couples have had to cancel their plans.
My wedding program, this is my baby girl, Yaksan, and then 25th April will have been the day. But then looking at this, so we have to change everything.
This couple says the pandemic forced them to change all their arrangements.
I have to call all vendors that we've contacted already, from the people with the hall to have a new schedule, to people who will be supplying us with drinks, to people who will be cooking. Everything just changed with this pandemic.
Ozohu is optimistic and says her company will find new ways to stay in business while maintaining safety precautions for herself and her clients.
I would have to use gloves, I would have to use a face mask, if possible use a face shield, okay, so that even if I'm talking or the client is talking, there's little risk of cross-transference.
Despite the restrictions over the spread of COVID-19, some couples are choosing love over the fear of contacting the virus. It gives hope to those in the wedding industry that they too will carry on. Ifyoke Etang for VOA News, Jos, Nigeria.
In our entertainment segment, Senegalese jazz artist Alune has one song for you to celebrate an especially jazzy week. Heather Maxwell brings us up to speed along with Kwame Ofori and 9 other acclaimed international jazz artists. Hello, Heather and Kwame.
Hello, Esther. Hi, Kwame.
Hey, Heather. Hi, Esther.
So this past Thursday, April 30th, was the 9th celebration of International Jazz Day. And it was celebrated by a virtual global concert and hosted by the American jazz musician Herbie Hancock. In the spirit of jazz, our song of the week is called One Song for You.
And it's by Alune with about 10 other artists. And he was the composer, he was the bassist, he was the guitarist, and he was the lead singer.
Yes. So let's watch.
Yep.
All right, so this is so cool, this song. And just so you know, Alune Wad is the two squares in the center. Alune was one of the featured jazz artists at the global virtual concert that took place Thursday, April 30th. And he's singing in Wolof, and he sings about the strength and beauty of nature and also of women. He says they're both the same thing, and they're sources of life, and they must be cherished.
Heather, for me, I love the music that they are producing, and I like the video. For those who haven't watched it, definitely go check it out on YouTube. It's all these different artists, 9 different artists, including Alune, coming together to create a beautiful sound. It's like 10 different sounds, but all coming in to be one. And I think in this time of COVID-19, this is what we need to be hearing and seeing.
Now, these musicians are from 6 different countries. There's Mali, Cuba, Morocco, Brazil, France, and Burkina Faso. I don't know about you all, but I really like the flute focus. I mean, there's the Burkinabe flute, there's the Brazilian flute, but I like the other things too, the strings, and it's just amazing. Kwame?
Yeah, it is. I mean, it's interesting you could distinguish the flute. It's very prominent in there, but then if you notice, there are so many strings going on, like in there. You have the bass guitar, the lead guitar, you have the violin, you have the traditional
mandolin.
One, you know. So
And
it's interesting is how heavy it is on strings, but you can hear the flute.
it's true. I must mention too the gombre. That is the square Ganawa instrument from Morocco. That's also really cool. So the credits that run at the end of this video name each artist, which country they're from, and what instrument they play. And if you follow their individual careers, you're going to find yourself in a fascinating journey of global jazz and African jazz. Anyway, I'm Heather Maxwell.
And I'm Kwame Ofori. And thank you, Alune, for this beautiful video with artists from all over the world. It was just beautiful to watch and beautiful to listen to.
And that was One Song for You, #1 by Alune Wad and friends.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, have a great weekend.